Dr. Hassan Tetteh, in his latest book, opens the introduction with a question: how do we prepare for the future with AI? His primary focus is on healthcare and AI, but it's subtitled Harnessing Military Medicine to Revolutionize Healthcare for Everyone, Everywhere. Dr. Tetteh is currently based at Howard University and Inova Hospital in Fairfax, Virginia, after serving 25 years in military medicine. His specialty is as a thoracic surgeon doing heart and lung transplants. He retired from the Navy in 2023. Dr. Tetteh, back in 2013, when we sat down, last time I saw you, last time we talked, you were talking about having been up all night transferring a heart to a hospital here for a heart transplant. Have you done any other trips like that since 2013?
I have quite a bit more actually, several hundred since then. Since we spoke so long ago, it's hard to believe it's been over a decade. But yes, I've continued to do that work. In fact, I joined a company recently, a group of outstanding physicians and practitioners in a group called Vituity, and I was brought on to be the vice president of operations to lead their new organ recovery service line as a way of addressing, the many challenges that that continue to exist in transplant surgery. And it's an exciting opportunity, great group of individuals, and I am still doing that work. Yes, sir.
When we talked in 2013, you were in the Navy and you spent another 10 years retiring in 2023. What did you do during those 10 years since I've talked with you?
Yeah, wow, that's a great question. What haven't I done is probably a better way of framing that. But I will say, since our meeting just so many years ago, it has been quite consequential in terms of my Navy career. I will tell you that if you recall, during that time, you met me at a period of a bit of a transition. I was obviously in the military, but I was just in the middle of a Robert Wood Johnson Health Policy Fellowship. And I was working at the Congressional Budget Office at the time in the Health and Long-Term Analysis Division. And I learned a tremendous amount during my time on the Hill, as you can imagine, notwithstanding all the health policy challenges and issues. But I really learned a lot from my cohort, my fellow peers that were in the group with me, outstanding individuals, many of which have ascended to the highest ranks of leadership within the government and the military. In fact, one of my colleagues right now is serving in a very high post. One of my colleagues encouraged me to pursue an interest that I had in technology. We have great banter and talks and conversations. And he encouraged me to really explore the burgeoning field at the time called clinical informatics. This literally happened as we were talking sort of, during our interview. So it's really giving you a sort of picture of what happened in the last 10 years that brings us, sort of to the current. And he told me about clinical informatics and this new specialty that was developing, and characterized it in a way that seemed very intuitive to me, because he said, well, it's a subspecialty, so you have to be board certified in one specialty. And then this is a way to sort of bring specialists and practitioners into the field that's growing called clinical informatics. And I was like, oh, really? Well, what's that about? Well, it's about computers and technology. I said, yep, check that box. I love that. I've been working with computers and programming computers all my life. And he said, well, it's also about administration and, leadership. And I said, okay, that's great. Military kind of fits that box. And then he said, it's about clinical practice. And I said, all right, cardiac surgeon, check that box. I'm all about that. And then he said it's about data and information and using information in a way that can inform clinical practice. I said, well, listen, cardiac surgeons do that every day. We take our data, we get feedback from our patients and from our outcomes, and we adjust and practice better, and we improve our practice. And so I said, well, this sounds great. And I was working at the time on the health record system for the military. And there was a pathway called the clinical pathway to sort of achieve this board certification. So fast forward a couple years after we had sat down, I became board certified in clinical informatics. And I remember going out to dinner to sort of, commemorate the occasion with my colleague and another one who had also worked on this subspecialty board certification. And we were sitting down at dinner, Mr. Lamb, and he said, Hassan, you may not realize this right now. And his name was Andy Gettinger. I'm going to call him out because he is such a great individual. And he said at the time something that was so prophetic, but yet so unbelievable to me that I couldn't imagine what it would have done to really just, literally take my career in a different trajectory for the next 10 years. And he said, what you've just achieved is going to be the most consequential thing you've ever done in your military career, in your medical career, let alone your military career. And I was like, oh, no, there's no way that's going to happen. I said, do you realize I'm a cardiac surgeon? You know what I do? I open up chests and I take out hearts and I take out lungs and I transplant those organs into other people and I work on complicated heart disease. And he said, trust me, my friend, you're going to look back on this time and say, this is the best thing that you ever done. You know, Mr. Lamb, within a year of him telling us that, my colleague and I both assumed positions in the military that I would have never imagined would have ever happened. So within a year of being board certified in clinical informatics, I was selected to be the chief medical informatics officer for the entire Navy. And you just wrap your head around that. And I think to myself, I've operated probably over my lifetime over thousands of patients, certainly done, many, many heart transplants and have been fortunate enough to touch a number of lives in my work clinically. But when you think about the responsibility, the oversight, and the impact that myself and my team had in Navy medicine and clinical informatics, we were impacting hundreds of thousands of people, literally, especially during a time when we were in the middle of acquiring our new electronic health record system, the MHS Genesis system, which is now in place. And so that led to more opportunities, a stint at the War College, which led to learning about AI, and then being recruited to do, probably one of my greatest most challenging, but also most impactful work in the last few years of my military career, which was being a part of the Joint Artificial Intelligence Center, which has reorganized into the Chief Data and AI Office now, but to be part of the team leading the Warfighter Health Mission Initiative for our warfighters and bringing AI into the military healthcare space and beyond, quite frankly. So in a nutshell, that's a long-winded way of saying the last 10 years have been quite exciting. And I've been fortunate and so very grateful to have been witness to a myriad of technologies that have evolved over the last decade, but really be part of something that is quite historic at a time when AI, has been around for decades, but it's now approached and has reached this zeitgeist where everyone is obviously talking about it and aware of it because it's been brought to the masses in so many ways.
I'm going to go back to the introduction of your book and just ask you the same question you ask everybody else. How do we prepare for the future of AI? And maybe before you answer that, what is it?
Yeah. What is it? Like, what is AI, right?
Yes.
You're absolutely, asking the right questions. And I think that's why I start the book with that question, because I want people to be thoughtful about appreciating this era that we're living in. And again, like I mentioned, AI, the term AI, right, was first coined in the 1950s, well before I was born. And so it's not like it's something new that's, fallen down from the heavens in any way. But your question is so accurate, is so timely, and it's perfect, because I think before you start having conversations about AI, it's great to define it for people. And, you have a different definition for AI. I have a different definition for AI. If we ask each other the same question a month from now or a year from now, it'll be different. So to set the table, what is it in my mind is human behavior being mimicked by machines. or said another way, machines mimicking human behavior. Now that's a very broad definition, but I think that's an appropriate definition for the purposes of our conversation, because it will sort of be the umbrella that captures most of everyone else's definition of what they think AI is. You know, I like to say there was a time when, if you look at the history of an evolution of our AI winter and sort of all of the different vicissitudes that we've been sort of traversing over all this time, people thought washing machines were AI at one point. You know, human behavior being mimicked by machines, machines mimicking human behavior. Now we've taken that to an extreme, I would argue, right? Because we're all walking around with supercomputers in our hands and we can ask ChatGPT questions. But again, human behavior being mimicked by machines, machines mimicking human behavior. So if that's what artificial intelligence is, how do we prepare for artificial intelligence? I would argue that we need to engage with artificial intelligence. We need to use artificial intelligence. We need to understand and appreciate artificial intelligence is the general purpose technology of our era. The general purpose technology of our era. A general purpose technology is one that permeates every aspect of human existence and life, much like fire did when it was first discovered, much like electricity is, and is now just in the background of our lives. Seldom do we appreciate it until it goes out. And then all of a sudden we appreciate, hey, there's no electricity. What's going on? So that is the way I think we prepare for a future with AI. In fact, it's our present right now, because AI is, in fact, part of our lives. And it's only going to become more impactful and, impacting our lives in a way that, will continue to hopefully bring us benefit. But my sort of admonition and I think advice is to prepare for this future by embracing it, to get to learn about it, to understand it, and to figure out a way to utilize it in a way that can, bring humankind and bring our human existence to a better place, just like with all technologies have done over the years.
Let me make it very personal and very simple. I'm about to have my yearly physical. I have to call the doctor. I then have to go in and get my blood work done. And eventually I sit down and talk to my doctor. And I only see him once a year. Because once you're out of that doctor's office, you're dealing not with doctors anymore, you're dealing with nurse practitioners. So along that way, and that simple thing, where is it going to fit in the future?
You asked a perfect question, and I illustrate examples of this in the book, Smarter Healthcare with AI. So I'm wearing a watch right now, all right? And this is my watch that it's gathering all kinds of information about me, how I slept last night. By the way, I'm getting a lot more sleep these days, but how I slept last night, my heart rate. Actually, I'm using an app right here that I just logged in what I ate for breakfast, and it's logging all my workouts. You've asked the perfect question. And this is just, like you said, it makes it very personal for how someone can see concretely how AI can help in their journey toward health and maintaining fitness. All of these sensors and all of this information and this data that's being gathered about me is being gathered for me and about me 24 hours a day, 7 days a week, 365 days a year. When I go to see my physician, I share this information with them. And now it's not just a snapshot in time. You're going to go visit your doctor, like you said, maybe once a year. You're going to spend a few minutes with that person, but yet you've had an entire year of things that have happened to you, your nutrition, your sleep, your stress, your exercise, your lack of exercise. All of that is impacting your health. But yet in that snapshot in time, we are, as healthcare providers, expected to render some sort of, big decree to say you are healthy or not healthy. How can we do that in just that period of time? We're only going by what we see in that moment. But think about having the accumulated information all throughout that year and over years, then you can see trends of my suggested intervention for you. I said, you need this medication, or I think you need to do this adjustment to your lifestyle. You need to change this aspect of your nutrition and diet. You need to rest more. You need to have more activity. I can see over time what my interventions are actually doing. So going back to my clinical informatics example, taking data to help us do our jobs better, that is why this field was so important and so interesting to me, because I said, this is what we do in cardiac surgery all the time. We take data and we make better decisions. With all of that information, Mr. Lamb, you can make better decisions about yourself, informed by your healthcare team that is using that information to make better decisions on your behalf. You can collectively make better decisions. So what AI can do is synthesize all of that information for you and serve up recommendations that can help you achieve your health goals and maintain your health, and ideally prevent chronic disease or treat it better or prevent diseases from occurring in the first place.
Now, this morning, I just happened to see this article online in a headline, and I'll just read the headline and see where it goes with you.
Right.
It says, Bill Gates, within 10 years, AI will replace many doctors and teachers. Humans won't be needed for most things. Do you agree?
I agree in part. And here's why. We already know the World Health Organization, the AAMC, the Association for Academic Medical Centers, the American Medical Association, you name the medical committee, organization, trade society, have all predicted we're going to face a workforce shortage in the future. So the one thing that's not going to happen potentially is that we're going to have less humans to take care of. We're going to have more people to take care of. We're going to have less of a workforce to take care of them. So how are we going to bridge that gap? One of the frameworks I advance in the book is this aspect of like productivity being the benefit of AI, being able to see more patients ideally in a more humanistic way, because you have this tool that can help you see more people in a shorter period of time. Or, as Bill Gates may suggest, have an agent, so to speak, replace that individual that's giving you information that can in fact be delivered through an AI platform, perhaps. I don't want to sensationalize that claim and say it's absolutely going to happen or absolutely not going to happen, because it's very difficult to predict the future, as you know. But I would say this: there is absolutely no question in my mind that a great number of the things that we do as healthcare providers could be done by an AI platform, meaning answering questions about health, getting direction about how to use or not use a medication, information about nutrition, information about diet and exercise. All of these things can be definitely conveyed in an AI platform, and actually done so in a way that gives the individual more access to the information in a more personalized way, in a way that just individual humans can never do unless they have a 24/7 dedicated doctor at their behest, which most people don't have. So what I would say is, I agree in part with the claim, but I'll add the caveat for those that may be listening to what you just said and said, oh my gosh, my doctor's going to go away. Or if you're a healthcare professional saying, oh my goodness, I went into the wrong profession. I will say this with certainty. Doctors that are using AI will absolutely replace doctors that are not using AI in the future. So I can say that claim with almost 100% certainty. Much the same way I think people that are not and never did embrace email or the telephone or things like that have been left behind. They're probably very good people. They're doing great things. But in terms of interacting with society and modernity, they have not necessarily kind of come on board. And I think that's what's going to happen in the future when it comes to healthcare.
We're going to briefly interrupt this conversation and continue in a moment.
I want to make sure everybody knows that they can go online on the C-SPAN archive or even through Google and find your interview from December 4th, 2013. And it's a lot more about your background and your life but it would fit well with this interview today. Because when you sat down with us in 2013, you had hardly had maybe 1 or 2 hours sleep. You had just flown out in the country, picked up a heart, brought it back for a heart transplant. I want to know, since that day, 2013, how has AI affected that whole process of heart transplant today?
That's a good question. The short answer, not much, unfortunately. Not much from a system standpoint, absolutely not made an impact at all in any meaningful way. The good news is, though, my team and I are working to sort of adjust that, because I recognize that AI has a great potential to improve the process, from the allocation process to the evaluation process of what organ is best fitted or suited for an individual that's needing that organ. Not to mention the logistics and all of the things that go into the myriad of, components that not only increase the cost of transplant, but make it, much more complicated than it needs to be. So that's the answer. Unfortunately, not much, but I think that's going to change and evolve with time. And I'm certainly dedicated to introducing a more AI first type of practice with the new group that I'm working with Vituity. But absolutely, it will have an impact in the future, just like AI will have an impact more so in the future with all aspects and domains of healthcare.
How do you define algorithm?
So the way I define algorithm is I put on my hat of being a physician and a practitioner. And there's sort of steps that we go through. If that, then this. If that, then this. If that, then this. And I think if you've ever, wrote code or written code for a computer, you know that you're giving a set of rules that are sort of probabilistic, and math is sort of foundational to all of that, probabilistic, for that each time the decision point needs to be made, you have a if and a then output type of situation. So in my mind, an algorithm is, if you want to think about it very simply as I do, it's sort of a recipe for how you make a decision based on a set of problems or a problem set.
In your personal life, when we talked, you had a 9-year-old and a 7-year-old.
I did.
We're about 12 years later. What are those two doing now?
Wow, that's a great question. So they've grown up quite a bit. In fact, I remember very vividly that was a very busy day, as most days for me are, before I visited with you. Because the day before, I was taking my son to Scouts, and then I got this call to go do this transplant. So that 7 and 9-year-old are now a 20-year-old and an 18-year-old. And I'm pleased and happy to say that my son is he's just about to finish his sophomore year at Wake Forest University down in North Carolina. And my daughter is a freshman, about to finish her freshman year at Emory University. She's actually at Oxford College of Emory, part of Emory. So yeah, and both of them, by the way, want nothing to do with medicine. At least that's what they tell me and my wife right now. My wife is a nurse. They've seen mom and dad sort of take care of patients and be involved in this healthcare enterprise all their lives. They both have decreed and have said they want to both be lawyers. So I know. I've been told by some of my medical colleagues that have children that have, gone through undergrad and grad school, and they said sometimes they change their mind, so they may come around. I've never pushed them into healthcare. My feeling is that they probably want to become lawyers because they've seen their dad spend a lot of time on the phone with lawyers. So maybe this is their way of saying, well, we'll get to talk to dad a lot if we know a lot about law, because he's always on the phone with lawyers. I've talked to patent attorneys and business lawyers, and I have good friends that are lawyers. So, I think it's a great profession as well. And I just want them to both be professionally happy and personally happy and healthy. And I'm very proud of both of them. My wife and I are.
You told us that your parents were from West Africa, that your father was deceased in 2013. Your mom was still alive. Is she still with you?
No, unfortunately, very good question. And I think I mentioned to you right before we started, I had a story I wanted to share with you regarding our interview, but it's a good time to highlight that story. My mom, unfortunately, passed away in 2023. So 2023 it was sort of a rough year for me in many ways. There were some good things and some bad things, but like life, I think you grow from all of these things. I've learned from adversity, and life has a way of making you humble in many ways, and so that's why I've lived life, I think, as fully as I can, but I've also been greatly humbled by life, and it's been a great learning experience. So in 2023, I lost my mom. Unfortunately, she died at 89 years of age. As you mentioned, both my parents are West African immigrants, and I think for them, they came to this country like many immigrants, wanting to, take advantage of the opportunities that that our great country has. And, I know that my mom and my dad were very proud that I became a doctor. My mom got to see me sort of mature into my career. But I will tell you, the last few years of her life, I would say almost the last 10 years of her life, were really challenging for her. She suffered from Alzheimer's, and so she had quite a bit of cognitive decline, and it accelerated just before she had passed away. And unfortunately, had to spend some time in a nursing facility as well. But as you can imagine, right, in 2013, when we had our interview together, this woman who had little more than a high school education, that came to this country with nothing, got to sit in front of the TV and see her son to see her son, Mr. Lamb, on TV with you, sitting there talking about performing heart transplant, and the book that he wrote, and serving, and, I'm sorry, and serving in Afghanistan. And she would watch that interview over and over. And, as she, lost her faculties as the years advanced, and we were able to get the video from a disc to YouTube. And so she could, at a click of a button with a TV, just get to it. It would be the one thing that she could watch, and you could just see her, even in her moments when she lost all of her, sense of who she was and what was around her, you could still see something in her eyes when she was watching that. She looked at something that she knew was familiar to her. And I can't thank you enough for, providing that, um, that, that opportunity for her to really, connect with something that I think, yeah, that she could always hold on to, even though she was losing everything else. So 23 was rough. So I lost my mom in 23. She actually died just a few days after I officially retired from the military. So it was sad to see her go. My son went off to college that year, so we became a half empty nest, and now we're a full empty nest. I transitioned out of the military, which, as I now come to appreciate, it was a very difficult thing. I thought it would be fine. I spent 25 years in this institution, and I said, "Oh, I'll retire. It'll be fine." And I realized, wow, when you've as you know, dedicated so much of your time and your life, and it's been such a part of your life for so many years, to now not be a part of it anymore, and be separated from that, it was a bit of a transition. It still is. And yeah, but there were some highlights in 23 as well. It's a great thing that my son did go off to college. So I have to look at the bright side of all these things. My mom lived to 89 years old, which is amazing, and she got to see not only you and I on TV and be proud of that, but she got to see over all those other years, her son and her grandchildren grow and mature, and I can't even imagine what she, must have felt overall. And I never had the opportunity to really have that kind of conversation with her, but, to come to this country with nothing, and to, be responsible for not only my life, but, all of the grandchildren, and impact that she's had on so many other lives. it's probably it's a life well lived, and one that I aspire to. So
where are you sitting today? Where are we?
I am in Potomac, Maryland, just outside of DC. I retired here, and at least for the foreseeable future, we'll be here. Both of our kids are at least on this coast of the country, so I'm told that by my friends that, you should expect to still make room for your kids after college because sometimes they come home. so we don't have any intentions of selling the house and downsizing and moving off to do anything like that. My wife is working as a school nurse at Stone Ridge, so local Catholic school here in Bethesda. I'm still doing my work in transplant, doing my work in human care technologies, which is all about advancing technologies and sort of bridging that work that I did at the Joint Artificial Intelligence Center. And DC is a great place to do that because it's proximal to New York. It's the epicenter of our country here. And we have great friends and family that are very nearby. So we like it. We'll be here for the foreseeable future.
One of the things in your book, and you're reflecting your experience in the military, but you say that, 26% of the deaths in the military at the top are from suicide.
Absolutely.
Now, please tell us about that, but also where can AI have an impact on that?
Yeah, you highlight something that's a bit tragic. It's ironic and sad to think that we in the military put ourselves in harm's way, right? We raise our hands to go protect and defend the country and uphold the Constitution. And yet the one thing that takes us out as military personnel, but also as veterans, is suicide. And I will tell you, personally, I can speak to this now. I told you how challenging it was, and I'm not expecting it to be challenging, of transitioning from the military and then going into the civilian sector. Even though I had a lot of activity in the civilian sector while I was in the military, so that's why I felt it would be a little bit more seamless and not so traumatic or stressful. But Mr. Lamb, it was very, very difficult to just really understand that you were now taking off this persona that you had of a military officer, especially if you've spent any time in the military of substance, a few years, in my case, 25 years. And then if you've deployed and you've done all these great things because you realize that you were part of something so important, so awesome, so bigger than yourself. And now you're just, some regular dude or dudette. And I think there's part of that feeling that you've lost your purpose, and if you talk to the behavioral health specialists, I'm sure that they'll say one of the greatest components of, people that become suicidal or have suicidal ideations is they have this hopelessness. And I think that is predicated on losing purpose. When you don't have a purpose, and I think my purpose, my persona has always been embedded in being a healthcare provider, physician. So I think that helped me a lot. But the fact that I was no longer an officer and I wasn't part of the military, it really did create this huge void for me. And not only that, sir, when I was trying to, and I write about this in the book, when I was trying to navigate the transition from going from active duty, where you should just walk into a medical facility and receive care if you needed it, or you had all these resources available to you. And oh, by the way, you're getting a salary because you've been in the military for so many years, you don't even think about it. And then to go from all of that, and then all of a sudden you don't have any of that, and now you have to sort of transition into a VA system to perhaps get benefits and receive care, that is not easy. You start to really feel like, wow, I did all of this work for all these years, and I served with honor and with pride and with courage. And now I don't have any of that anymore. And now I have to really fight to get some of these benefits and to sort of be a part of this organization again. There was a time, and I write about this in the book, a very poignant time where I was just so frustrated. I was trying to navigate the whole VA system, and this is not something that was unique to me. I know this to be the case for many of my colleagues. And I just could not get any traction at all. Couldn't get any help, couldn't get any assistance. And I remember walking out of the facility, again, with frustration and not being able to see a person and being told that I have to wait many weeks and in one case, many months to see someone, texting my wife and saying, now I know why military people kill themselves. And fortunately, I didn't go there myself, but I just felt so frustrated, and I said, wow, this is such a system that needs incredible improvement. So to bring that back to your question about how can AI help, AI can help in so many ways. We talked about the shortage of personnel and how AI and platforms can bridge that shortage of personnel. The synthesis of our medical record as military personnel for providers can be done and can be accelerated, can be made much more efficient with AI. And I know this to be the case because one of the projects we worked on while I was at the Joint Artificial Intelligence Center looked at this very scenario at a time when our capability was less robust than it is now. So you think about the fact that you have to take your record during the time that you're in the service and then deliver it to the VA system so they could look at it and see what conditions or what disabilities may be associated or not associated with, a rating for you for disability. And all of that information is largely electronic right now. Why not use a system or a platform that can synthesize all that in a very effective way? And we're not utilizing and leveraging it, in my opinion, to the benefit of some of our service members right now. So I think there's huge opportunities for AI to help in that regard. The other ways to help is I'm using my phone here. I have a colleague of mine. We're working on a platform that's chat based. It's been trained on the entire corpus of cognitive psychology, if you can believe that. And this gentleman's practice, it's called Dr. Holo, and it's a bot. And every morning it checks in on me and it says, "How are you doing? Good morning, Hassan. How's your day going today?" And I can have a conversation with it. And the intention is not to replace the psychiatrist, but it's to do what you had suggested, which is to be this bridge in between the visits. So if I were to be seeing someone from behavioral health on a 6-month, 2-month, whatever it was interval, this chatbot could be sort of the in between connection with that healthcare provider. And if there was anything that were to come up, there was an alert or a concern, then that person can get that information. So I'm using it as a test right now, but it's been incredibly engaging, just to have, a platform check in with you every day. That's sort of an extension of, your care team, if you will, from a behavioral health standpoint. And I see how that could be potentially helpful too, just checking in on an individual. Because as you know, there's lots of literature that suggests, even our former Surgeon General highlighted this during his tenure, loneliness is a very real and consequential condition that many people are dealing with. Coming out of the pandemic certainly exacerbated and made it worse. But that's also one of those, factors that could lead to someone losing purpose and feeling hopeless, and then ultimately, having a situation where, they may be considering self-harm or even worse.
Please excuse us for interrupting. We'll continue our conversation in a minute.
I don't know what the word is to use, but I was going to say chide you, but that's not fair. But in your book, years ago, I served in the United States Navy. And the one thing that I picked up in your book and I started listing was the acronyms. Your book is full of acronyms.
Yeah.
And I'll give you an example and you can explain it because and why you use them all the time. Here's one: DEEDS, DEEDS, and its framework, and it stands for Dynamic, Enhanced, Ethical, decisions support. Now, did you write this book for an amateur like me, or did you want somebody that understood all of these acronyms and all to read this book?
It's even worse. I wrote it for an amateur like me, sir. I wrote it for someone who's not very smart and needs lots of memory aids. I would never have got through medical school if it wasn't a way for me to understand really complicated things and sort of boil it down to words that I could remember. But honestly, you're right. The military is full of these acronyms. I probably should have included a little bit of a glossary. I tried to explain as many of them as I could throughout the book. But that's one of the frameworks for me that helps to characterize a very complicated subject when you apply it to this field of AI. Dynamic, enhanced, ethical decision support. Like, what does that mean? Well, I go and write in and hopefully give you a good explanation of what that means. But, at sort of the outset, I'm trying to make things simpler for the reader and hopefully guide them through a way of better understanding a complicated subject in an easier way. So, I wasn't writing it for you as an amateur. I was writing it for me as an amateur to sort of help me better understand and, more importantly, explain complicated things in a very simple way. And I hope I achieved that. I really tried to be deliberate in doing so. But that particular framework is important because one of the things that I've come to appreciate over all these years working in the clinical informatics space, certainly in healthcare, but very, very clear to me during this time of AI, especially when we're thinking about its implications in healthcare, is what about the ethics? And it's sort of a strange question to sort of ask, right? Because AI is a tool. So do you think about ethics when you're using a hammer? I hope so. You're not going to take the hammer and go hit someone over the head. You're going to use the hammer for, building something great, hopefully. And I think AI, and in this conversation about ethics, they can't be binary conversations, in my opinion. You can't just think about, let's build this AI and then think about the ethics. Or let's think about ethics and then not build AI, because then you don't get very far. So one of the things I try and advance in that particular, in fact, I dedicate an entire chapter to ethics and AI, and I call it operationalizing AI and ethics together. Because as you're using the tool, you should always be practicing ethics. It shouldn't be one comes before the other or one comes after the other. You can't function like that. Life doesn't work like that. In my opinion, if you're doing anything and you're using a tool, as we are in this case, a very advanced tool, we should always be practicing ethics.
What would be unethical in AI?
What would be unethical in AI, in my opinion, is to discount the fact that this tool could be used in a way to harm patients, or worse, to harm populations. So not just one patient or group of patients, but an entire population. What do I mean by that? You can use AI to exacerbate disparities in healthcare. We already have disparities that exist right now. So if you're building a tool that's aimed at helping a population, a group, and certainly an individual, then don't build that's going to make those gaps worse. Don't build something or a tool that's going to exclude an entire population of individuals by which the tool will never ever have any relevance or any help, and then make a disparity even worse. That I think is unethical. That's terrible to do. But you can use this tool to actually close and narrow that gap. Some people have asked me questions in some of the audiences that I've been talking, and they're like, "Oh, well, I don't think we should use AI, and it's going to replace doctors, and it's not going to allow a patients to see a patient, or to see a patient who needs to see a doctor." And I think to myself, I said, "Wow, well, that's a great perspective, but I think it's narrow and it misses the point of how you, again, should think about using this tool." So, Mr. Lamb, in that scenario, what about a community in a third world country that doesn't have a doctor for like hundreds of miles. In fact, they don't have a doctor anywhere near them. But you have a cell phone and you have this ability to convey telemedicine, and you have sensors and other things that could actually help gather input and information that can be objective in terms of helping to facilitate a diagnosis or understand a condition better. Well, think about that. How would you deny AI, telemedicine, that technology to that group of individuals at a very low cost, and now provide them with access to a health professional that they would have never had access to otherwise? So that's the kind of thing where I think it's unethical to not advance that paradigm in some way, especially if there's a way to intervene, help that individual in that community and that population have access to care and services that they otherwise would never have been able to access.
I want to go back to the heart, because you've spent a lot of time on the heart, and I want to know how much of this is AI. Today, you have the pacemaker, you have the defibrillator, you have the small EKG little thing, and then go to the doctor's office, and even you have the ability for the system to remind you it's now time for you to come back to see your doctor, your heart doctor. How much of that has changed over the years, and how much of it matters?
That's a great question. I think it's changed a lot in the last few years. It hasn't changed as much in, maybe decades. If you're measuring decades, probably not too much has changed. In the last 5 years, a lot has changed. In the next 5 years, I would argue much more is going to change. Much, much more. What difference has it made? I think it's made a great difference. It's made a difference in the fact that all of that information that you use in the example for the heart, for example, has helped to inform the patient, helped to inform the cardiologist and the care team, but it's also given sort of the system more of a sense of what our interventions are doing when it comes to heart disease. Are patients complying with their medication? Have diet and exercise impacted their patients in certain ways? There are patients that are being monitored, as you suggested, 24/7, especially if they have, some of the latest devices in terms of pacemakers and other sensors that are monitoring their heart health in so many ways. As you know, there are watches now that can detect if you have an arrhythmia and then alert your care team and then, have you sort of go down an algorithm to receive the right kind of care. So I think all of those things are collectively helping to inform better clinical practices, helping to inform and empower patients with more information about their health so that they can hopefully identify things and triggers that may send them down a path where their symptoms become worse or exacerbate symptoms that they already have. But more importantly, they can also appreciate the things that help improve their health or prevent, whether it's an arrhythmia or some sort of condition that they have, from getting worse based on perhaps diet, perhaps exercise, perhaps following the instructions of the doctor or not following the instructions of the doctor, and then having a conversation of how they could adjust some of their lifestyle and their behavior so that they can achieve a better outcome for health. Your example is such a great one when you started with, I'm going to see my doctor tomorrow. And I can't emphasize how much people don't appreciate how much of your health happens outside of that doctor visit. That doctor visit is in no way indicative or informative of what Mr. Ram's health and state of health is or has been for the year and will be for the year coming up. It is just simply a snapshot in time. But now we have an ability to gather information throughout the entire year about your health, about your condition, that you have access to, you have agency over, and more importantly, you can see what has been impacting all of those different data points. Has sleep impacted it? Has diet impacted it? Has health, has stress impacted it? Has your medication compliance impacted it? And that can inform your healthcare team so that when you come and see me in the visit, it's not just this 15 minutes that I'm talking to you or just sitting in front of you and now making a determination on your state of condition or your holistic, composition of health. But now instead, I'm informed by a year's worth or several years worth of information, which, by the way, all of the interventions I've prescribed and hopefully my other colleagues have prescribed, that now we can now look at a holistic, comprehensive picture of what do we need to do to work together as partners to get you to a place of health and to prevent chronic conditions from getting worse. And ideally, promote longevity and fitness and all those things that we all strive for.
I asked you a question 12 years ago about the cost of running out in the country, finding a heart, bringing it back, having it transplanted. And I said, $1 million, a couple 100,000. You never did define exactly what it would be. Do you have a better idea today what that costs to transplant a heart?
I do have a little bit of a better idea, but I'll caveat my answer by saying you're asking a very good question, and I'm glad that you remembered that I didn't give you a perfect answer, because, sir, that perfect answer does not exist. And I'm going to couch this with its relevance and its impact to AI and technology today, because this very same question in a different way was asked to me just last week. I was at Harvard Medical School giving a book signing event, and someone asked me the same question. They said, well, how do you bring technology into healthcare? And a slightly different question, and what's the cost of that? And I'm going to answer your question this way. I could not give you an exact cost for what the heart transplant cost, because I told you there were many variables involved. Where am I going? Am I going, I'm here in Maryland. Am I going to Baltimore to get the heart, or am I going to, Minnesota to get the heart? Whole different equation there, because, that's the cost of gas and tolls to Baltimore or getting on a private jet and flying to Minnesota. So totally different. But to bring it down concretely to the questions you're asking about cost and healthcare, and I learned this even in greater detail and granularity when I was at the Congressional Budget Office, is that healthcare is one of these American healthcare, let me be very clear. American healthcare is one of these very unique industries, unlike any other industry in the world. If you call a plumber right now and say, hey, I have this leaking pipe in my bathroom upstairs, they'll come in, look at the pipe and say, this is the pipe. I got to get this pipe. And by the way, I charge $250 an hour. It's going to take me an hour and 25 minutes to fix this pipe. This is what your bill's going to be. And you're going to say, yep, I got it. And you're going to say, I want to do it or not do it. And you'll write the check after they finish the work, and that transaction is done. You go into the grocery store, Whole Foods, Safeway, wherever you shop, and you put something in the basket. You could actually take the gun in the back before you even go and scan everything. You know exactly what it's going to cost down to the penny. You transact it and go out. If you go to the ER right now, Mr. Lamb, I challenge you to do this. And you go in there and make up a condition. Pretend you have some. I hurt my ankle. And limp on it or whatever, or really have something serious. And you go in there, they'll do a whole bunch of things. They'll take some insurance information if you have insurance and you're fortunate to have that or not. But they have to see you. Someone's going to see you. They're going to do a whole bunch of things. And at any given point, I would charge you to ask the people that are engaging with you, hey, can you tell me how much this is costing me? They would have no clue. And you wouldn't either. And when you go into the triage area and ask them, hey, you just took my blood pressure. How much is this costing me? No one will be able to give you a straight answer. And then if they get an x-ray, you ask the x-ray tech, how much is this costing me? No one will be able to tell you. And then at the end of that entire visit, they'll let you go home or maybe, keep you for some observation. But eventually you're going to get a bill. And that bill is going to have a whole bunch of things in that. But at no time during the time when you were getting the point of care did you know how much that was going to cost you. And I would argue that if you knew, you might have said, hey, wait a minute. Do I really need this? Do I really want this? Is this really necessary? And that is one of the strangest things about healthcare in America, that we are, both the provider, the institution, and the patient are completely agnostic to the cost at the time of transaction, at the time of care. No other industry works like that. So when you talk about introducing a technology, whether it's heart transplant, AI, X-ray, PET scan, MRI, like all of these things that can have a very good and positive effect and impact on an individual and a society, and not really discuss the cost up front, it makes it very, very difficult. And by the way, everyone's incentive is sort of malaligned in this whole very complicated world of healthcare in America. And I think that's going to be one of the great challenges for how AI gets implemented, or how any technology gets implemented into healthcare. So the way I answered that young lady's question was the following. I said, you're asking a very good question. Whenever you introduce a technology into healthcare, there are three things that I think absolutely have to be navigated and negotiated and understood in very good detail. The first thing is validation. Is this AI? Is this MRI? Is this heart transplant technology good? Does it work? Does it actually help people, or does it harm people? Validation is very important. That's why we spend a lot of time in healthcare doing studies and getting randomized controlled trials before we allow drugs to be introduced into the market in the healthcare space. So validation is the first thing. The next thing is scalability. If my condition, or my solution rather, only works for Mr. Lamb but doesn't work for Mr. Smith or Mrs. Johnson, and only for you, it's not a really good solution, because it's great for you, but it's not great for everybody else. So it's not really going to provide the greater good for society and in healthcare. Heart transplant is great for a lot of people that need a heart transplant, but what would be better, in my opinion, is preventing the things that brought the person to needing a heart transplant if possible. That would be great. But we don't spend a lot of time on that, unfortunately. And then the last thing is sellability. Well, who's going to pay for it? I think this is one of the reasons why there are great technologies in the Silicon Valley of death. And people that brought up great solutions and had these great ideas that probably had the potential to do a lot of good in healthcare and in society, but they never figured out who was going to pay for that. And if you can't get someone to pay for it, especially in our American healthcare system, because by the way, everyone's agnostic to it. It's not a point of care type of thing unless you're doing concierge medicine. You walk into a healthcare institution, lots of things happen to you. You have no idea how much it costs until well after the transaction or the episode of care is over. No other industry works like that. So sellability. So I think, when we have this conversation about AI, yes, it is expensive, just like, a lot of very sophisticated technologies and tools are, and therapies are. There are many drugs that are very expensive. Heart transplant is very expensive. AI can and may be very expensive as well. But there are also areas where it can be very cost effective. And I think as we mature this technology, we introduce it into the healthcare ecosystem, we have to always keep in mind, are we validating it? Is it scalable? Can it help a lot of people? And how are we going to pay for it? Has to definitely be something that's critically, considered throughout the introduction of all of these new technologies and tools, particularly AI.
So in closing, I had a personal friend probably 30 years ago who spent 3 months in a hospital waiting for a heart. He got it. They put the heart in his body and he died the next day. And I just remember it had a lot of impact on me personally. And the only reason I'm bringing this up is I want to ask you, how often in your experience does the heart transplant not work?
Yeah, and I told you it's very infrequent. I mean, it's very unfortunate that your friend and of course you and his family had that experience, because we go through so much consideration when we're putting a person on a heart transplant waiting list, or a lung transplant waiting list, or any waiting list for that matter for an organ, because it's such, as you know, such a resource intensive gift. Not that the individuals don't deserve this, but I mean it as you know, it takes so much. So there's social considerations, there's support. Does the individual have a family support after they get the transplant? We have all of these different components that kind of come into play. They'll see a pharmacist. They'll see the medical people. They'll see the surgeon. They'll see nutritionists. They'll see behavioral health people, because we want to make sure that they have the right state of mind and sort of the agency to be able to understand and appreciate this great life-changing event that's about to happen. They're going to get a new organ. They're going to have to modify their lifestyle to some extent. They may have had to change some of the behaviors they had even before they get on the transplant list, so that, they don't potentially fall into the same situation with the new organ. So when you told me that, I could tell it definitely impacted you personally, and it doesn't happen very frequently. And I would say one of the reasons why, in my opinion, it doesn't happen very frequently is because transplant medicine is one of those very unique specialties where I wish we treated every patient with every condition the way we do in transplant. Because when you have a transplant patient come up for consideration for an organ, when they're experiencing end organ disease in any, liver, kidney, heart, lungs, pancreas, like I said, you have an entire panel of people considering you as an individual. Think about that. You have nurses, you have behavioral health, nutrition. What if we treated diabetes like that? Can you imagine if we had a social worker, we had a pharmacist, we had a nutritionist, we had the medicine person, we had the endocrinologist, we had surgeons, we had everyone come to bear to say, how do we treat Mr. Johnson's diabetes? And you had all of those experts thinking about, considering what's the best therapy for you. It would be amazing. But we don't do that for everybody. We do that for transplant patients because we know that it's such a huge resource intensive thing. So kind of coming full circle, you'd asked about, is AI being used to work in organ transplant right now? No, it's not, unfortunately, not in any meaningful way. I hope to change that, because I think there's great potential to take all of this data that we have about the individual that needs a heart transplant or whatever organ they may need if they're in that kind of condition, and then all of the information we have on the donor, and then all of the external factors, how far away are we going? What's the condition going to be like? What do we encounter in the operating room? We have the ability to visualize organs, both with video and with pictures, and we can take a lot of this information that can inform our decisions, so we're making the best possible assessment of the organ in the context of who's going to receive it. And again, there's nothing more that I would want than to prevent people from ever having or requiring a heart transplant or a lung transplant, because some of these diseases are due to chronic conditions that could probably be ameliorated or hopefully prevented if some interventions were made beforehand. And it kind of goes back to this opportunity, this great opportunity I think we have right now for healthcare teams and as well as individuals to understand their health, understand their composition, and to have agency over their whole continuum of health with all of this data we're collecting. And that can give us insight onto how to make the best decisions across our entire life for how to maximize our health, our fitness, and ideally prevent us from needing to have the requirement for some of these interventions. And then when we do need those interventions, let's make the best decision so that we minimize something that is unexpected. In your case with your friend, it does happen very rarely, fortunately. But when it does happen to a family or to an individual, it's very impactful because it's you. It's like when someone asked me, what are the statistics or what are the chances for whatever intervention we're going to have? I say, I don't really like to talk in statistics, because if it happens to you, it's the most important thing and you're going to be impacted. So let's talk about that. Yeah.
We've been talking about a book called Smarter Healthcare with AI, Harnessing Military Medicine to Revolutionize Healthcare for Everyone, Everywhere. And our guest has been Dr. Hassan Tetteh. We thank you so much.
Thank you, Mr. Lamb. I just want to end with just really, again, expressing how truly grateful I am that, so many years ago, you were gracious enough to invite me to visit with you to discuss that book. because not only was it probably one of the greatest things that happened to me in my career, to be able to be on a national platform with you and all you've done with C-SPAN, but because of what you gave as far as a gift for my mom, because in those many years after that, that great time that we shared together, I know watched that event and that moment and that exchange with us with so much joy, even when, she lost a lot of who she was. It brought her a lot of satisfaction, a lot of joy, and a lot of pride. And so I'm grateful to you for that. I'm so grateful for the privilege I've had to serve. I'm grateful for the opportunity that I have to heal. I'm very grateful for the chance I have to teach and inspire and to lead, as I am doing now, and to create the greatest good for humankind. And thank you again for giving me this opportunity to share my new book and the work that I'm doing with Vituity and others to make an impact in the world. So thank you.
Thank you, sir.
Thanks for tuning into this week's Booknotes Plus podcast. If you have a moment, please consider rating and reviewing us wherever you listen to podcasts. Your feedback will help others discover the program. And don't forget to share this episode with friends and family. For the latest on new episodes, schedule updates, and more, follow us on X @C-SPAN Radio.